A few days ago, when I shared some data showing that Spain was on the same trajectory as Italy. That is, even though Italy had 10 times as many cases, growth in the daily number of cases was almost identical. It took Italy 6 days to go from about 150 to 1,000 cases, and it took Spain the exact same amount of time. Now, March 13th, we have updated data. Spain has just surpassed 4,000 confirmed cases. Why was this so predictable? It's because if you have similar societies with similar disease control measures, identical human biology, and an identical virus, the results can basically be predicted. When Spain reached 150 cases, that appeared to be about the critical mass after which contagion across countries is very similar. So to go from 1 case to 10 cases, from 10 cases to 100 cases, this is very hard to predict because each individual behaves very differently, randomly, right? But once you're at a critical mass, that randomness kind of cancels out. And so the time it takes to go from 150 to 1,000 or from 1,000 to 10,000, given a similar set of circumstances, is going to be pretty similar across different places and different times. The Italy and Spain similarities are not a one-off case. In fact, the Italian trajectory is the same trajectory being followed by the disease outbreaks in most of the Western European countries and in the United States. The only difference is that Italy is a few days ahead of these other countries. The US, Germany, France, the UK, Denmark, we all seem to be on the Italian trajectory. Now let's compare this with the outbreak in China, excluding the Hubei province. These gray lines on the chart show Chinese provinces. Chinese disease control measures, social distancing, active case detection, kept cases to a minimum. So there's some hope from China's trajectory. There's hope from other countries too. Let's take a look at Singapore and Japan. They went past the 150 critical mass, but managed to keep growth thereafter to a minimum. And then there's South Korea. Even though South Korea got to some pretty high numbers, since then they've taken effective measures to control the outbreak. There are a lot of variables that we don't know, like the number of people that are infected but don't get tested. What we do know is that reactive measures are very ineffective at controlling COVID-19. What we've seen in the case of China is that outside of Hubei, provinces were able to keep caseload relatively low by taking very proactive, very drastic measures. What we've seen so far in the outbreak in Europe and in the US is that these reactive measures, kind of piecewise, slowly reacting to new cases with incremental shutdowns, confinements, quarantines, doesn't seem to have been sufficient to slow the tide of the outbreak. What we do know about this disease is that it can spread very rapidly across a population, and that it has very high mortality rates among those who are particularly vulnerable. We also know that it has the capacity to saturate and oversaturate health services. So even if it doesn't necessarily kill you directly, it can kill you or it can kill people by virtue of having basically taken health services past their capacity. So my message, having examined these data, is that the scenario is changing extremely rapidly. We need to take this very, very seriously. We have not taken it seriously enough so far. Just 10 days ago, the total number of COVID-19 cases around the world was about 110,000, and 80% of those had come from mainland China. Now, 10 days later, we are at double that number. That is, we went from 110,000 to 220,000 in just 10 days. But growth is not uniform across countries. In fact, in China, there have only been a few hundred cases in the last week. But in the rest of the world, outside of China, we've gone from 30,000 cases to about 140,000 cases. That's a more than 400% increase in only 10 days. And those 100,000 new cases, 100,000 new cases in 10 days, it's almost certainly a vast underestimate because there are a lot of people who may not have been diagnosed but are infected and infectious. In the early days of an outbreak, raw numbers matter more than percentages. And the reason why is because contagion generally stems from just a few foci. And that's why the trajectories and the number of cases are so similar across countries with very different population sizes. Comparing the number of cases by location is very messy because of differences in health-seeking behavior and differences in testing rates. In other words, we don't know how many cases there are, not even close. So maybe deaths instead of cases is a better metric for measuring the magnitude of this pandemic. Let's take a look at deaths. 10 days ago, outside of China, there had been only 702 deaths. And now, 10 days later, that number is closer to 5,000. That's a 7x increase in 10 days. But there are a few problems with death. One, age structures are very different in different populations. Two, health service quality differs across countries. Three, there's greater lag. That is, the time it takes to go from exposure to death can be very long. 5 to 10 days from infection to symptom onset, another week from symptom onset to becoming a severe case, another few days from having become a severe case to dying. So a lag of, let's say, 3 weeks. We can use deaths as a proxy for contagion, but when we do, we're not really measuring how bad the outbreak is now. We're measuring how bad it was a few weeks ago. It's kind of like driving a car while only looking out of the rear view window. You can see where you've gone, but you can't really see where you're going. So to know where we're going, we have to use math, models, statistics. And as they say, all models are wrong, but some are useful. And what the models say is that the number of cases, and therefore by extension, the number of deaths, is going to continue to grow exponentially until the effect of our current control measures begin to kick in. So the situation is very serious and it's going to get worse. And we, society, government, parents, scientists, we need to be real about this. We need to be real about expectations, and we also need to be real about the magnitude of this crisis. The numbers are bad, but they're not hopeless. What we've seen in a few Asian countries is that when radical measures are taken, that leads to a radical reduction in the growth trajectories. Public health authorities have to do their part, but we, society at large, can help them. We can save the lives of the people we know and love, and we can save the lives of strangers by just staying home, listening to health authorities, practicing social distancing. We are all links in the chains of disease transmission. And when we isolate, what we do is break those chains. By just staying home, we are no longer a stepping stone for the virus to jump from someone through you to someone vulnerable. Social distancing. There is no easier way to save lives.
Okay, so let's go over how to properly don and doff personal protective equipment, PPE. In particular, this is going to be PPE for airborne, droplet, and contact precautions. We'll start off with the donning or putting on procedure, and we'll wrap up with the doffing or removal procedure. But before we get into those procedures, let's talk the basics. What's the equipment that you're going to need to do this, protect yourself properly? The first thing is going to be a gown. You'll also need an N95 face mask. This is going to be for the airborne precautions. If you don't have one, you can use a surgical mask, but just realize this is not going to be for airborne. This will just be for droplet and contact precautions. You'll need a face shield. Alternatively, you can use goggles if that's all you have. And you'll need a pair of gloves. You'll also need an appropriate hand hygiene station with an alcohol-based antibacterial, antiviral solution, a trash bin, and an area where you can put this on and take it off safely. So usually when you have a donning area, it's going to be outside the patient's room or outside the isolation room where you have all your equipment, you have your hand hygiene station, you can put things on safely and take things off safely. Before you start, you also want to think about, well, what do you have on your person? If you have jewelry such as watches, rings, earrings, necklaces, you might want to consider taking those off as they can be nices for infection. If you have long hair, you're going to want to put that hair up. Alternatively, in addition to that, you can wear a hair bonnet. And if you have a big facial hair, you're going to need to shave that off so that you can appropriately have a good seal with your N95 mask. So let's move on into the donning procedure. The first thing you need to do, and this is a cornerstone for PPE, is good hand hygiene. And the way I think of hand hygiene is I usually do 2-3 pumps, and it should take about 20 seconds. I start off by rubbing the front of my hand and the back and get really good contact between the two palms. And then I move to the back and I go in between my digits with the opposite hand down to the web spaces. And I'll repeat that for the other side. Same thing, really getting in between those fingers. Remember your thumbs now, they stick out, so you're going to want to do those individually by rotating them in the opposite palm for both of them. And then don't forget the tips of your fingers. In order to get the tips of the fingers, I will rub them in a circular fashion in the opposite palm and do the same for the other side. And then I'll finish up by rubbing the rest of that alcohol sanitizer till it's completely dry. And now you have the proper hand hygiene to move forward and start putting on your gear. The first piece of gear we're going to start up is going to be the gown. So gowning up. What I like to do is I like to open it up and I check it for defects, right? Holes, tears, tabs that may be missing that won't allow me to put it on properly. Once I am assured that it's good, I'll start by putting my sleeves in. This one goes over your head. And you'll notice you have these 2 thumb holes. Those are going to be for right before you put your gloves on. You don't need to do that right at the beginning, but realize that you will need that to get a good seal between the glove and the sleeve. Tie it up in the back. If you have a necktie, you'll do the necktie. This one doesn't have one. It just goes over your head. And then now you're gowned up. The next step is going to be your face mask, so the N95. And when I'm doing the N95, I like to cup it in my hands so that I have my 2 straps here. And what I'll do is I'll put it onto my face and pull that first strap over my head to the crown of my head, right at the top. And the second, the lower strap, I'll pull over. And you want to bring that all the way down to the nape of your neck where you don't have any hair. Make sure that the straps are nice and flush. And now you're ready to mold the mask to your face. This is really important because you need a good seal to protect you from any of those airborne precautions, the viruses that might be aerosolized. The molding process starts at the nose. I push and mold it along my nose. And then what I'll do is I'll move around my face to make sure I have a good solid seal. And this is why you can't have a beard, you'll break that seal. The last part really is checking for any air leaks. And to do that, you'll exhale and feel for air leaks around. If you have any of those, you need to readjust the mask so that you don't have that air leak coming in and out. And so now you're masked up, you're molded, it's sealed. The next step is going to be the face shield or the goggles. If you're wearing goggles, it's pretty much put them on, put the strap back. These need to go over glasses if you wear eyewear. Typically though, we have face shields. Same thing with this, it has a padding that will go on the forehead. You want to take that strap, put it to the back. You can tighten to make that nice and snug. And the really important part is to make sure that the face shield comes all the way down below that mask, protect you from anything that may be coming in terms of the contact of the aerosolized or the sputum that may be coming from your patient. And finally, it's going to be the gloves. So when I do the gloves, I'll put my thumbs into the sleeve holes, and you just basically put your glove on as you would any old glove. And the key here is to make sure that you pull that glove above the cuff of your sleeve so that there's no skin showing between the glove and your gown. And that's why you have those little rings. It really ensures that you have that length to cover it up. A quick note.
Just 10 days ago, the total number of COVID-19 cases around the world